There's no doubt that our health sector has been underfunded for 9 years before this government came to office. And so as a government we have put a record amount in 2018 and then further funding again a record amount in 2019. We've put aside huge amounts for capital rebuild of our buildings, but it will take some time to build those services up, to build up the workforces necessary to deliver the care that we would like to see across the country.
We look at other neighbouring areas like the West Coast where there's maybe $100 million gone into the 2 new hospital facilities over there. Why, with our rapidly growing population and our 3 million visitors a year, do we not get the same level of expenditure?
Well, across the country, the Treasury estimates about $14 billion needs to be spent in the next 10 years to build up our hospital assets. Thus far in the first 2 budgets, in terms of capital, we've put aside twice as much as the government put aside in 9 whole years, and so we're very serious about building up that infrastructure. One of the key bits of work is actually looking to build a national asset management plan so that we have a list of all the assets in the country, the state of them, what needs replacement, but also a vision for where we're going to, with an eye to the growing population centres and so forth. Ultimately, the DHB has a big say in how it plans for the care of its area. But there's no doubt that the government needs to build up a bigger picture that hasn't existed historically about what the needs are of the communities that we're growing and how we're going to go about meeting them.
We ran a petition last year, which I'm sure you saw, of 7,000, 8,000 people saying we need a hospital. But what's your response to them? Because that question still hangs over us.
The DHB tells me that one of the big challenges, of course, is maintaining the skill levels of staff in those big tertiary centres. You've got to have a big population base to maintain 24-hour services. I'm really pleased to see that they are growing services here in Queenstown. The opening of the new facility today is a really good step, and I would expect them to keep engaged with the community.
There's been a lot of dissatisfaction with maternity services, and you yourself have called the SDHB on that. Is there light at the end of the tunnel? Because a lot of the midwives here are saying that they're concerned there might be the death of a mother or a baby if we don't do something soon.
Well, obviously my associate Julianne Genter leads on these issues, but I know she in recent days has given some clear instruction to the Ministry, the Ministry of Health, to be overseeing what the DHB does, to give her confidence in their progress. The report and review that was done was critical. There's no other way to put it, of the implementation of the maternity changes, and so I'm expecting, as she is, that the review's recommendations be followed through on.
We understand that there's been a population model used for planning health services so far, but we have so many unusual situations here, like we have the 3 million visitors that I've mentioned, we have an earthquake that's overdue, we're a long way from Dunedin. Do you think the government's model takes those factors into account sufficiently?
Well, one of the big pieces of work that's at play at the moment is the Health and Disability Sector Review, which reports back to me in March next year, and its task is to look across the whole system. Say, should we have DHBs at all? Fundamental questions like that. The PHOs in their current form, do they add value? How do we structure our health system to take account of our future population needs? And they do some good studies in their interim report on what the population growth looks like around the country, the demographic changes, and project forward as to some of the needs we'll have in future. I think that piece of planning work is critical in thinking about where we go from here.
All of which sounds great, but just finally, if the concerns here that get expressed to us every day about maternity service and general health services continue to be expressed, will you give an undertaking, can you give an undertaking to stay across that, to look after the people that live here?
Well, Julianne Genter, I know, has come down to the DHB to meet with midwives, and I commend her for that. I think it's appropriate that she has reached out and is staying in touch with those communities to make sure that confidence is rebuilt. The DHB has a huge job to do in rebuilding the confidence of the community and the midwifery services that are here. The midwives do a great job in New Zealand. They are a stretched and strained workforce. Their pay has gone up roughly 20%, the LMCs in the last 3 years. We want to see them remunerated better into the future, and we want to grow that workforce because these are critical people in our health system. We want to look after them.